Hello friends, I am Dr. Vijay Prakash and today I'll be talking to you about failures in fixed partial dentures. Now, we often say we talk about success in fixed partial dentures and that relates to comfort, meeting the aesthetic need of the patient and also the addressing the function of the patient, and all this should be in harmony with the somatognathic system. But usually we fail to acknowledge the importance of failure. Failures are equally important because they help in learning what all mistakes we have made, and we can always correct those mistakes, and then we can ensure that we have a more clinically durable and a successful fixed restoration. Now, what are failures of fixed partial dentures? If we see failures of fixed partial dentures, the classification given by Bernard G. Smith says that failures can be because of the loss of retention, there can be mechanical failures of crown and bridge components, and this can be subclassified as there can be porcelain fracture, or there can be failure of the shoulder joint. There can be distortion of the fixed partial dentures. There could be occlusal wear and perforation of the crown, which we see clinically, and there can be also lost facings. And third type of failure can be changes in the abutment tooth, like the periodontal diseases, problems with the pulp, caries, mostly the secondary caries, the fracture of the prepared natural crown or root, and movement of the tooth. Another type of failures can be based on the design. When you are not selecting a proper design of the fixed partial dentures, they can be under-prescribed bridges or the over-prescribed bridges. And you can have inadequate clinical or laboratory techniques. They can be further subclassified as a positive ledge, negative ledge, defect, poor shape and contour, and there can also be failures because of the occlusal problems. So if we see all these causes of failures in fixed partial dentures, we can group into a number of factors. These factors can be biological factors, mechanical factors, which are responsible for fixed partial denture failures, or they can be aesthetic factors. And also they can be a psychological or psychogenic cause for fixed partial denture failure. Now let us see each one of them one by one. First, the biological failures. Now they can be grouped, and they can be caries, they can be secondary caries. So if your fixed partial denture is not fitting well, suppose there is a gap between the crown and the tooth surface, and you have just cemented that, and there is a partial gap between this margin between the restoration and the tooth structure, then chances of secondary caries will be very high in this region, because there will be food lodgement and chances of secondary caries will be there, and this will amount to failure of your fixed partial dentures. So always make sure that your fixed partial dentures or a crown, whatever type of prosthesis you are giving, is accurately fitting the tooth structure, and there should be no compromise on this aspect. Secondary caries can also be in a tooth which is adjacent to your fixed partial dentures. Suppose your fixed partial denture, there is a mild gap between your fixed partial denture and the natural adjacent tooth. So chances of food lodgement will be there in this area, and definitely the patient will be having periodontal problems, and you'll be having cavity in this region. Patient can have your root caries, or there will be secondary caries in relation wherever food lodgement is there. So definitely you have to make sure your fixed prosthesis should not have any space in the proximal area. So there should be no proximal gap between the fixed partial restoration and the natural tooth. Now, second factor for biological failure can be pulp degeneration. And how does that happen? That is when you are reducing the tooth structure. Suppose you are not using a copious quantity of water, there is a lot of heat generation, then chances of pulp degeneration is there, or if you are over reducing the tooth structure and the tooth is having large pulp horns. Say patient is a young patient which is having large pulp horns. So in those cases also you may have pulp degeneration, and chances are you may have post-operative sensitivity which may demand that you have to do an endodontic intervention. So in order to avoid such a situation, always remember that you should use your coolant should be good. The water coolant from the aerator handpiece should be good. They should be properly directed. It should not happen that the water spray is somewhere else and your burr is in some direction and the water spray in some other direction. So definitely there will be heat buildup on the natural tooth, and the chances of pulp degeneration will be very high. Also, it is very important to do proper diagnosis and treatment planning, because if you are not diagnosing well, the chances are you may land up into failures of the fixed partial dentures. Next biological factor is gingival recession and periodontal breakdown. That may happen if you are having a subgingival finish line, and if you are encroaching into the biological width initially, then there are a lot of chances that the patient will be having, maybe you give the restoration, but the patient will come to you after some time and you can notice there will be gingival recession, and there will be also periodontal breakdown because of the loss of alveolar bone. So in order to avoid this type of situation, you should always plan and diagnose well, and accordingly make a decision what type of design, what type of restoration in that particular situation, in that particular type of clinical situation would be best suited. So accordingly you take a call and then you deliver the restoration. Periodontal problems can also be because of patient not maintaining having a poor oral hygiene. He's not maintaining whatever processes we have given, then and there are food lodgement, patient is not able to clean that area, especially under the pontic, then definitely there will be periodontal problems, there will be periodontal breakdown, there will be loss of alveolar bone, there will be deep periodontal pockets, and definitely that will lead to failure of your treatment. Next biological factor is the occlusal problem. Now, whenever you are inserting and restoring, cementing fixed restoration, maybe a crown or a fixed partial denture or any type of fixed inlay onlay, any type of fixed restoration, then you have to make sure that there is no premature contact, the restoration is not high, and the forces are well directed along the long axis of the tooth. Because if you leave a premature contact, then the patient may come back to you with post-operative pain, and you can also see there could be mobility of the tooth. So it is very serious. In fact, you have to make sure that there is no premature contact. You should check the occlusion before sending the patient after your treatment, and you should correct accordingly. Any premature contact, you should definitely reduce that and make sure that the patient is able to bite evenly on both the sides and there is no high point as such. Next biological failure can be tooth perforation. Now this may happen when you have a lot of destruction of the coronal tooth structure, but the root is intact, which is having a good alveolar bone support. So in such a situation, after doing endodontic treatment, in order to provide good support and to the tooth, you may go for a post and core, or even you may be thinking about giving amalgam pins if you are doing an amalgam restoration. So in such situation, there may be a chance that you may perforate the tooth. So that will also lead to failure of your treatment. And if this perforation is left undetected, then definitely there will be a lot of problem later on once you send the patient after your treatment, and the patient may come back with periodontal abscess or a periapical abscess. So definitely there will be failure of your treatment. Next biological factor can be cementation failure. Now, this usually happens if you are reducing too much of your tooth structure and you are not obeying the principles of tooth preparation. And in a figure in front of you, you see there is multiple path of insertion, that is withdrawal and insertion. So definitely the chances of dislodgement of the crown will be very, very high in such a situation. So definitely whenever you are doing a reduction, you should ensure that the tooth has adequate retention and resistance form, and also the cement which you are using in a proper ratio, that is the proper powder liquid ratio, and you are inserting the crown when during the working time. It should not be that you are inserting and cementing the crown once the working stage of that cement is passed, then you are trying to fit that. So definitely the crown is going to come out. There will be cementation failure of your restoration. So all these things you have to keep in mind so as to avoid cementation failure. Next factors are the mechanical factors. Now under this, there can be loss of retention. Yes, if you are having a long span bridge and you are having inadequate support, that is you are not obeying the Anti's law, then chances are definitely that there will be loss of retention of one of the retainer, and mostly that retainer is the distal retainer. So chances of dislodgement of this crown is very high. If of course you have not done the preparation according to the principles of tooth preparation, and your designing is not correct and your planning is not correct, then the chances of failure will be very high in this type of cases. So definitely your planning should be good, and make sure whenever possible you should have adequate teeth used as an abutment teeth in order to support the fixed partial dentures, especially in a long span bridges cases. Next type of failure can be Pontic failure. Suppose the Pontic which you have selected for your fixed partial denture, that Pontic should meet several requirements, like it should be hygienic, or it should at least help the patient to maintain good hygiene. So give proper design of the Pontic so that the patient will be able to maintain good hygiene, and then it will lead to longevity of your treatment. Next type of failure is the connector failure. Here the connector width, especially in the all ceramic bridge, the fixed partial dentures should be 4 into 4 millimeters square, and in a PFM case, that is porcelain fused to metal, it should be 2 into 3 millimeters square. So you have to keep in mind, because if your connective width is not adequate, the thickness is not adequate, then definitely there are all chances of failure of your fixed partial dentures on occlusal forces. Like a case we see in front of us, this is a zirconia bridge fixed partial denture, and because of lack of adequate thickness of the connector, there was fracture in this region which you see between the distal retainer and the Pontic, that is this region. So definitely the width, height and thickness of the connector should be adequate in order to resist the mastigator forces. Next type of mechanical failure can be occlusal wear. So there can be, if the patient, especially if the patient is having a parafunctional habit like bruxism or clenching, then there are chances of occlusal wear, and the wear can be really very severe, and definitely with that you may also have a situation in which we see instances where the metal is perforated with function. So definitely first thing is you have to provide adequate space. The interarch space should be adequate, and there should be good structural durability of your restoration in order to avoid such type of failures. And definitely case selection is very, very important in order to avoid such a situation. Next type of mechanical failure is tooth fracture. Now, tooth fracture as such is kind of a rare type of mechanical failure. It can be possible if you are not, if your case selection is not good. Suppose the tooth is caries and the patient is having a poor oral hygiene, and still you have gone ahead with making a crown or a fixed partial dentures, and the patient returns with secondary caries or periodontal problems. There may be chance that there can be tooth fracture in function of your restoration. If the tooth is weakened by secondary caries, definitely there can be chance of tooth fracture. So definitely your diagnosis and treatment planning in such type of cases is very, very important. Next type of mechanical failure is porcelain failure. As you can see, usually this area of the fixed partial denture. So in function, it can happen because of the chip off, because of crack, or because of the traumatic bite of the patient. So if this fracture, definitely it can lead to failure, and you have to ensure that your restoration is not having any kind of crack line in the restoration, or the reduction is not adequate, so that you don't have a material which is adequate in thickness, which may just fracture. So this is what you need to keep in mind. Next type of failures is the aesthetic failures. Aesthetic failure can be improper shade selection. This is very, very important. You have to be careful when you're selecting the shade. You should always keep the patient into the loop and see your shade selection should be done under natural light if possible. The tooth should be wet. So these are all the criteria whenever you are doing a shade selection. Always inform the patient, show the patient the proper shade matching, and accordingly you can take pictures, and you can then pass this information to the lab, so that there is no mismatch when you get the final restoration. There is no confusion and there is no mismatch between your restoration and the natural tooth. Next type of aesthetic failure is failure to identify patient expectation. Yes, it is very important, because you cannot give unrealistic expectation to the patients, and later on the patient build up those expectations, and then it is a problem, because you have to identify from the beginning what is the patient expectation, and accordingly design and inform the patient whatever will be the outcome of the treatment. Another important type of aesthetic failure is failure to communicate a proper shade to the lab. As I told you that you should take pictures, the profile pictures under natural light if possible, and you should communicate that to the lab, and also you can draw a diagram of the tooth, and wherever possible you can make you can divide the tooth into quadrant, and like nine parts, the tooth into 9 parts, and accordingly you should mention the shade, the difference in that, any staining which you want, or any type of crack line which you want the laboratory technician to simulate. So accordingly you should inform the lab, and this communication is very important with the laboratory, in order to because the laboratory technician, if the technician does not do a good work, then there are all chances that the patient may not appreciate your work, and it will lead to aesthetic failure. And sometimes if your communication is not good, then you may result in such type of processes, which is definitely not acceptable in any way. Next type of aesthetic failure is opaque layer is too thick. Now, if the opaque layer is too thick in your restoration, then definitely you will not get good translucency, and the tooth will not give a natural look. It will be more an artificial look, which the patient may not appreciate, and it may lead to failure of your restoration. Another type of aesthetic failure can be a thick metal margin at the incisal and the cervical region, especially if your reduction is not adequate, and your gingival biotype is a thin biotype. Then in those cases the showing of the metal can be there, and if your reduction is not adequate, then the cervical, the ceramic will be inadequate, it will be thin, and chances are you'll have a thicker metal margin which will look unaesthetic, especially in the anterior region. Next type of aesthetic failure can be failure to produce translucency. Yes, you definitely have to reduce enough. Reduction should be adequate so that you provide space not only for the opaque layer, the body layer, but also for the enamel, and it provides adequate translucency. Translucency provides a good natural look of the restoration, which will be highly appreciable by your patient. Another important type of aesthetic failure is an over or under contoured crown. If a restoration is over contoured, then it is going to encroach into the embrasure space. As you can see, it will encroach into the embrasure space. It will lead to periodontal problems will be there in such a patient. So definitely your reduction, whatever type of restoration you are making, should not be over contoured. At the same time, it should not be under contoured, because if your restoration is under contoured, there will be food lodgement in between your restoration, and again the patient will be having periodontal problems, and there will be failure of your restoration. Next type of aesthetic failure can be exposed metal margin in connector, incisal or cervical region. That usually happens if your interarch space is not adequate, and there is a compromise between the metal thickness, and there is no space for the ceramic to come in. So definitely you have to make sure that you do adequate reduction so that the technician has space for both the metal and the ceramic. Another type of aesthetic failure can be overglazing. Like if you are glazing the restoration maybe 2 times or 3 times, then definitely it is very much shiny, and it looks kind of artificial when compared to the natural tooth. So that may also lead to an aesthetic failure. So you have to avoid all these factors which I have just discussed in order to have a successful fixed partial denture restoration. Another type of factor which can lead to failure of your restoration is a psychogenic factor, wherein the patient, you are not able to recognize the patient, understand the patient's requirement, and the patient may be having some other problem. Maybe the patient may be depressed or maybe having anxiety. Then whatever type of treatment you do, the patient may not appreciate that as you must be expecting. So definitely you have to recognize that, educate the patient, understand the problem. That is the reason why diagnosis and treatment planning of your restoration of any type of case is very, very important. So if you keep in mind all these factors, you can have a successful fixed partial dentures which will be having good clinical longevity. So with this, I'll come to the end of my presentation. Thank you for watching the video.